Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Inguinal canal. So before we move ahead with the inguinal canal, let's look at some diagrams. So first we look at the boundaries of the inguinal canal, the diagram. So there is a deep inguinal ring and the superior inguinal superficial ring. So this is how it connects. Next, let's look at some muscles. So there is a TA, this is transverse abdominalis. Next, there is another muscle, this is internal oblique. Then there is a lining here. This is for the external oblique aponeurosis. So it is aponeurosis. So TA stands for the transverse abdominalis, IO is for the internal oblique, EA stands for the external oblique aponeurosis. Next, this canal, what we see is the inguinal canal. And on top, just like the EAO, that is external oblique aponeurosis, this layer is known as the fascia transversalis. It is fascia transversalis. Then on top, there is a tendon. This tendon is nothing but it is the CT, that is a conjoint tendon. It is conjoint tendon. Then in the bottom there is a reflected part of the inguinal ligament. So this is nothing but reflected part. It is reflected part of the inguinal ring, inguinal ligament. Now let's move on to the theory. So the inguinal canal, it is a 4 centimeter long. It is 4 centimeter long and intermuscular canal. It's 4 centimeter long and it's an intermuscular canal. And it is directed downward, forward and medially. So it is downward, forward and medially. Downward, forward and medially. And it extends from the deep inguinal ring to the superficial inguinal ring. So it extends from the deep inguinal ring to that of the superficial inguinal ring. So from the DIR to the SIR. Now let's see the boundaries. The boundaries are simple. So firstly, the anterior wall. What are the structures forming this anterior wall? So here it is skin, superficial fascia, the external oblique aponeurosis. So this includes the whole extent. And next one is the muscle fibers. And this will be the of the internal oblique, muscle fibers of the internal oblique. That is the lateral 1/3. So what will be the posterior wall? Posterior wall will be the PP, that is the parietal peritoneum, then the extra parietal tissues, EP tissues, then the fascia transversalis. So parietal peritoneum, so P, right? P for posterior parietal peritoneum, P for the extra peritoneal tissues, and then the fascia transversalis, which involves the whole extent. This is the whole extent. Now then in posterior wall there is also medial reinforcement. That is medial reinforcement by the conjoint tendon. This is by the conjoint tendon and reflected part of the inguinal ligament, as well as the reflected part of the inguinal ligament. Now let's move on to the roof. What is present in the roof? So in terms of the roof, it includes the arched fibers. There's presence of the arching of the fibers. So there's presence of arched fibers, and this is nothing but of the internal oblique as well as the TA. So internal oblique as well as the transverse abdominis. This forms a conjoint tendon medially. So it forms a CT medially. So it is the internal oblique as well as the transverse abdominis. Now what will be the floor? The floor is the groove surface of the inguinal ligament. So it is the root surface of the inguinal ligament. Next, there is also presence of the lacunar ligament. There is presence of the lacunar ligament. So this lacunar ligament, it is present in the medial side. So floor medially there is a lacunar ligament, and there is also a grooved surface of the inguinal ligament. Now let's look at about some points about the deep inguinal ring. So here in the deep inguinal ring, it is a oval opening. So deep inguinal ring, it is oval opening, and it is present in the FT. FT means the fascia transversalis. And where is it situated? It is situated 1.25 centimeters. So it is 1.25 centimeters above. So it is 1.25 centimeters above what? Above the mid-inguinal point. So it is about the mid-inguinal point. Next, we look at the superficial inguinal ring. We are writing it as SIR. So superficial inguinal ring, it is a triangular opening. It is a triangular opening, and this is in the external oblique aponeurosis. External oblique aponeurosis. It is situated 1 centimeters. So 1 centimeter above. So 1 centimeter above, and lateral. So it is above as well as lateral. And above and lateral to what? To the pubic crest. To the pubic crest. So, or it can be medial to the pubic tubercle, or it can be medial, and this is to the pubic tubercle, P tubercle. To learn and grow daily like this, please do subscribe.